Next up, I'm pleased to introduce Dr. Sophie Leftley. We've known each other for a long time. On the first of the Living Well with VEDS, a patient view of the experience. Thank you, Sophie.
Hi, I'm Sophie. I'm 51 and a self-confessed craftaholic. So I used to be a GP and public health doctor, but that's an interesting thing to start with because it's what I used to do. And one of the things I've thought a lot about over the years is that at our core, we are human beings. We be, we are, we don't do, we are values and we are relationships. My first obvious event happened back in 2012. I'd had quite a rough time during pregnancy before that, but I'm really very grateful that I've got my son who is 20. And apart from that, I'd had really, really severe crashing fatigue since my early 20s, which made being a junior doctor really, really very challenging. When I got bleeped in the middle of the night, the nurses used to say I looked worse than the patients, but I guess that was POTS manifesting. So thinking about living well and what that actually means made me think back to days of doing sociology and psychology and health research, and the famous psychologist Abraham Maslow, who came up with the hierarchy of needs, which is all about what a human needs to become their best self or to be able to reach their full potential. And there's obviously lots and lots of basic needs, including shelter and food. And of course health is one of those very, very basic needs if we're going to achieve our best selves. So NICE guidance back in 2024, 2025 was concerned that patients with rare diseases were in danger of becoming unsupported in the healthcare system. And it talked about the needs for highly specialised knowledge programmes, which of course we are so lucky to have with our specialised service. The UK Rare Disease Framework talks about faster diagnosis, increased awareness amongst healthcare professionals, better coordination of care and increased access to specialist care, treatment and drugs. These all sound like really good aspirations, but in the reality of an overwhelmed NHS out there in the field, they don't always seem very achievable, which is why we're very fortunate to have this community, to have Annabelle's challenge, and why we really, really do need to focus on self-advocacy. So, just taking a moment to think about some of the challenges and barriers to living well with vascular EDS, I just wanted to start off with the shock of a diagnosis and the grief that can come when you have to face a new normal and leave the old you behind. But then that's a double-edged sword because diagnosis can sometimes bring validation if you've had illness for years and not known why. For me, feeling of guilt and feeling like a fraud is a biggie. In terms of the fatigue levels, not very good at pacing myself. I find it really hard to learn how to do that because I'm a bit of an activist, and when I've got a bit of energy, I'll use it to the nth degree and then end up in a boom and bust cycle. When I'm feeling well, I feel like a total fraud and feel like I'm not as ill as I think I am and that I should be working. Sometimes still when I go to outpatients, doctors will say to me, where do you work at the moment? And I feel awful saying, well, I'm retired because, you know, I've had 3 brain aneurysms and who knows what the life expectancy is, and I'm totally exhausted most of the time. And I've had a lot of self-talk about being useless, not being productive and being a burden. And of course fatigue's a big barrier to well-being. It really cramps my style. Uncertainty is a big one for me, and it's not so much about the fear of something catastrophic happening, it's about having a variant of uncertain significance. So I'm really, really excited about this new research that's happening. It's very difficult thinking about my son, who's now 20 and has had various things throughout his life, and something recently that's made me think, oh, because he hasn't got my variant, but then we've not had a skin biopsy, so we're never going to really know. And the irony is, since he started university, he's decided to become a lacrosse player, and he's discovered alcohol, etc. So yeah, and the uncertainty thing also speaks to when you have a serious pain and you're sitting there having a debate with yourself about whether to mobilise the troops, whether to sort out some childcare, sort out some pet care, go to A&E. Is it going to be not something serious? Are they going to think I'm a neurotic hypochondriac? And I have to sort of mentally slap myself around the face when I'm thinking like that. And remember, when I did my surgical training, we were always taught that general surgeons should be taking out double the number of appendixes with suspected appendicitis than actually needed to be taken out in order to not be missing any. So I kind of apply that to serious pains and think, well, okay, there's going to be times when I go and it isn't anything, and actually that's a good thing, by the way, in order not to miss the time when it is serious. Comorbidities, so other medical problems that don't have anything to do with the vascular EDS, that's really difficult to manage. I'm kind of stuck in a situation at the moment where I had a bowel bleed back in December and was referred as a 2-week rule, urinary cancer, and still haven't had the investigations because of all the sort of debates about what's going to be the best way to do it. So that can be very difficult, and I am going to mention something which is quite a trendy buzzword at the moment, which is medical trauma. So we have had difficult encounters with doctors who have been dismissive or treated you like you're neurotic. It can really affect how you feel when you present when you are in an emergency situation. And also, I think because sometimes hospital systems don't speak to each other and sometimes notes aren't available, you can end up in difficult situations. My main one is having had far too many CT scans, so turn up as an emergency, and it's much easier and quicker to get a CT scan than an MRA. And then, I've had a consultant saying to me, please stop having CT scans because you're going to get cancer. But then when you're in the acute situation, that's all that's on offer. So, I feel like I'm glowing kind of thing. Anyway, not to be all doom and gloom, what are the solutions? Or what have I found is helpful in terms of living well with vascular EDS? Well, it's a work in progress. All our lives are works in progress, really, aren't they? But I found a website which talked about 5 aspects of well-being and life. And the first one, the top thing, was connection. So, what does that mean? Well, I think that us being here today is a manifestation of that. It's about sharing experiences, being with people who understand. And I do recognise that actually there are times when people want to step out of this whole sphere and get on with their lives and not focus on it. But this group's always here, and always here for advice and support. I think find your tribe. This is something a friend once told me about 3 o'clock in the morning friends, which is the friends you can count on one hand, who you could call at 3 o'clock in the morning for a crisis. And for me, it's the friends who forgive the flakeouts. So they forgive the multiple cancellations at the last minute because of ill health, but still invite you to things anyway. The friends who, when you go to visit them, know you might need to go to sleep for an hour the minute you get through the door. They're really, really important. And I think back on connection as well, advocacy. So I have realised a lot that it's really good to learn. I've heard some really, really good points on self-advocacy about how to come across. It's difficult to come across as calm when you're in crisis. And I realised actually from talking to people last night how important it is to actually skill up a buddy. It might be a partner, it might be a sister or brother or a friend, but it's that person who can speak for you in a calm way when you're in a difficult and stressful situation. I think that's really important. So activity was another pillar of well-being. For me, I love gardening. I have to be really, really strict with myself because I'm not very patient, and if I need to ask my husband to dig a hole, I just need to learn to wait for him to dig the hole rather than going ahead and digging the hole and then worrying about pain for the rest of the day. And I think also for me, don't be seduced into programs which are designed for people who are baseline well. So for me, it's been the Conqueror challenges. I don't know whether anybody's seen them, but they're virtual challenges where you can sign up, for example, to walk from Land's End to John O'Groats, and you get virtual pictures and you say, I'm going to do 1.5 miles a day, so I'll finish it by 6 months' time. And there's a lovely glossy medal that you get at the end of it. and you pay for them all, and you think, oh, I'll do that one as well, and this one, and then you end up realising, no, I can't even commit to half a mile a day, because some days are different. Some days I can't get out of bed, and some days I can. So activity is about doing stuff that you can do that's sustainable, so you don't set yourself up to feel like a failure. New skills is another pillar. My husband and I are learning Greek. Don't ask me why we started that, but hopefully we will go to Greece at some point and put it into practice. Hobbies. Hobbies is a difficult one when you've got ADHD, because it can be quite expensive, because there's lots of different hobbies to try, and my latest one is sewing. Slightly in love with Patrick and Esme, but I've got a lovely sewing room all set up. I make bags, I give them away, just gives me a lot of pleasure. And I think I've promised you a rag doll, haven't I? Or two. Not got round to making them yet. But yeah, new skills, that's a good one. Another pillar of well-being was giving. We hear a lot about practicing gratitude, which can sound a bit cliched, but giving, I think, does make you feel, if you've had a career in the past or a job that you've loved and you've worked really hard and you are stuck feeling like you're not fulfilling your potential in any way, then giving is a really nice thing to do, even if it's just being a counsellor to your friends, or if it's running a support group, or, you know, helping out in a local charity shop. But I suppose it's helpful if it's something that doesn't require a regular commitment and is flexible enough that if you're poorly you don't feel you're letting people down. And a very, very big one is mindfulness. And there's an awful lot of scientific research that it's not just woo, it's actually scientifically proven to bring blood pressure down and bring the parasympathetic nervous system on board. So sympathetic nervous system is your fight, flight, fright, the thing that makes you stressed, the thing that gets your blood pressure up. Mindfulness is really proven to bring your blood pressure down. And I think it's a good way of combating negative self-talk as well. So if you look at the compassion-focused mindfulness therapies and some of the Buddhist traditions, then that can be really, really valuable. And just for me, I would add that my faith has helped me. The lanyard scheme is brilliant if you want to get through an airport quickly and not have to stand in queues. I think half the time it's because they think you're going to kick off and be a bit scary. So when you get out, get through VIP channels, it's fabulous. I often feel like I'm being to try people because I kind of look quite normal, really. Advocacy, self-advocacy is a skill to learn, and having a buddy I think is dead important. Being ready, having the pack, having a plan, what you're going to do with the dog, what you're going to do with your child. If you need to go to hospital, you don't want to be stressing about that at the last minute. One thing I picked up from a recent Fans and VEDS Conference, one nugget I brought home was, it's unforgivable to run out of your tablets, particularly your blood pressure tablets. And I do it all the time because none of my tablets are in sync. They all run out at different times. But yeah, this is one thing we should really try to guard against, is running out of our tablets. Holidays, I think holidays are important. Personally, I don't go on flights longer than 4 hours, and I always look at whether there's a decent vascular unit near where we're going to. The days of trekking around Africa are definitely over, I think. Sharing knowledge is really important. And I think if you get a doctor, whichever of the specialties it is, or whether it's your GP, if they care and they're willing to advocate for you and write to other specialists, cling on to them. Usually when I get one like that, they're close to retirement, but I think that they are really amazing. So I don't know how much time I've got left, if any. Have I got 2 minutes? Okay, I'm just going to share a poem with you that I wrote, because poetry helps as well. It's a bit like therapeutic writing, gets it out of your head. And it's about tiredness. Energia, my capricious friend, you come sometimes, your gift to lend. And when you're here by my side, I lose my fear, enjoy the ride. We do things, you and I, we live a life, at least we try. And then, so sudden, you desert, and I am left, used up and hurt. These ups and downs, this endless cycle, are how I live, once drained, now vital. But shade exists because of light, and whilst I know you'll take your flight, I will endure the bust and boom, that I may have my chance to bloom. So I'll sleep then when you go away, recover for the next good day. Your rhythms may be unforgiving, But life, my friend, is worth the living.